Hey, this is Doug Field along with my co-host Brent Macy and our guest host Liz Fair with Intrepid Consulting, and welcome back to this segment of Healthcare Consumerism Radio. And continuing the discussion on the consumerization of healthcare, and leading this segment will be Dudley Slater, who is Division President with Cambia Health Solutions. Dudley, good morning.
Good morning.
Give our market background on yourself and Cambia Health Solutions, please.
Sure. So I've been with Cambia for a year and a half, and my role is President of the Direct Health Solutions Division. Mm-hmm. And the Direct Health Solutions Division is a complement to our legacy health plan business, and together our health plan companies and the Direct Health Solutions companies are comprised of 25 different businesses that really all work together to bring change to the way people experience healthcare, and the goal here is to fulfill our cause, which is to transform healthcare to make it more person-focused and sustainable.
Dudley, when you and the team at Cambia and with Regents, I mean, what was the trigger that set you on this course to create this diverse portfolio of companies that represent a lot of different solutions around consumerism?
Well, I think there's a variety of triggers, but Cambia institutionally has a long history of innovation.
Mm-hmm.
We're proud of the fact that our roots go back to the formation of the very first health insurance business in the country at Pierce County Health up in Tacoma, Washington, where a bunch of families of loggers got together and realized that occasionally healthcare presented challenges to families that families could not afford, and innovated the idea of health insurance nearly 100 years ago. And to this day, the organization has deeply embedded in its DNA the desire to, constantly evaluate the healthcare landscape, and where we feel improvements can be made for the betterment of health outcomes in our society. We attempt to innovate, and Direct Health Solutions, the division I lead, is really, the most current form of that. And it was about 11 years ago that this was started. And really, again, the goal is to transform healthcare to make it more person-focused and sustainable. And I think, the underpinnings of that are, the observation that healthcare has grown, healthcare costs have grown to represent, 18% of our country's GDP. Those costs, if you look back over the last 30 years, are growing at what clearly is an unsustainable rate. And so I don't think it takes a rocket scientist to conclude that, there's a lot of good things that healthcare does for our country. There's room for improvement, and that's really what Cambia is committed to doing, is to make it more sustainable and person-focused.
So what are the benefits of putting the consumers at the forefront, putting them in that leading role? What are the benefits?
Well, I think, it's true if you look at most all other industries that an active and engaged consumer is ultimately the driving force that fosters increased levels of innovation, which we think will lead to better health outcomes. And an active and engaged consumer, we think, will also encourage market forces that include competition and other dynamics that we think will really help bring control over the cost of care. And lastly, healthcare at the core of successful healthcare outcomes is the relationship between the patient and the physician or the
mm-hmm.
provider.
Mm-hmm.
And having engaged consumers is only going to help strengthen that relationship as well.
Dudley, with you in a leadership role and your companies as far as healthcare transformation, what are the challenges that you and the companies under the Cambia umbrella face?
Well, like everyone, we come to work every day with a lot of excitement around the opportunity to make a positive impact on healthcare. So, while we have challenges, I wouldn't for a moment discount the degree of enthusiasm that the Cambia workforce shares toward our cause. But transformation is not easy. It takes time, and today the healthcare landscape is really governed by an entrenched operational model that has evolved over the years, and we need to execute on our cause and pursue the transformation that we're trying to pursue in the context of that landscape. And that what that really means is we have to work in a way that excites consumers, that really drives consumer change, and that means challenges like building distribution models and sales engines that really bring our innovative ideas out to the marketplace. Healthcare is very competitive, and so we do that in the embracing the notion of the competitive market environment, and at the same time, this all has to be done in the context of the existing third-party payer model and working with the existing provider infrastructure, and all of those established ways that healthcare operates have to be embraced. At the same time, we attempt to bring change and innovation. So it's a marathon, not a sprint, but we're very excited about where we're headed.
I think you're doing some really good things, but it's also is it not about exciting the benefit buyer, those employers out there that sometimes are resistant to change or need to understand why they need to change, and those stakeholders that are working with them?
Yeah, that's definitely a part of it. Although I'll tell you, my own dealings with the employer marketplace is that employers are hungry for change. I think employers are frankly fed up with the status quo, and they've been trained to accept double-digit price increases. They've been trained to accept a payer environment where they're given limited choices in terms of what they can offer their employees. And in response to that, employers are looking for change, and you see them demanding change as they embrace higher deductible plans, and they take steps to shift more of the payment burden onto the consumer and their workforce. Employers are embracing public and private exchanges at a very rapid pace, and so we found that the models that we're building are really receiving exciting levels of demand and support. And examples of that are, we have what we believe is a leading transparency business in the form of one of our companies called HealthSpark that now serves, by our estimation, up to 100 million members across the country, and that includes employees of a number of significant employers. And transparency really is we think it's at the tip of the spear when it comes to consumer-driven change, where if you provide consumers the tools to engage and exert the power of the consumer in terms of shopping on price, having quality metrics that consumers can use to make the best choices for their healthcare outcomes, that those are going to be embraced, and that's exactly what we're finding. We've found very strong demand for that, and we have other businesses that give, like HealthSpark, that give employers tools, real tangible tools they can offer to their workforce to allow them to be more engaged in their healthcare choices and to get more of a tailored experience that ultimately brings better outcomes. And so, well, the behaviors have evolved over decades. We find that the employer and the consumer marketplace is hungry for these innovative concepts.
No, we agree. Dudley, we agree with you. I got about 30 seconds to go. Tell our audience how they can learn more about, the Cambia group of companies.
Yeah, well, there's a lot out there. I mean, the best place to start would be to go to our website, CambiaHealth.com, and then each of our operating companies has their own individual websites. And, of course, we'd be delighted to, take any direct inquiries and put people in touch with our trained professionals who can help, guide them in the right direction to see if we can be helpful.
Thanks, Dudley, very much. And to our audience, Scott Decker at HealthSpark. The HealthSpark company is one of our CEO industry innovators and our upcoming superstars. And congratulations to Scott. Dudley, we really appreciate your time. Have a great weekend. And if you can join us at IHC Forum West, November 10th through 12th, love to see you there.
Great. Thank you. It's been a delight. You folks have a good weekend as well, and we'll look forward to talking more.
Thanks, Dudley.
Thanks, Dudley.
And to our audience, stay tuned for Healthcare Consumerism Radio.